Self-care is the foundation of good pain care. On its own, it can help you to reduce pain and improve your ability to function. Or it can be used in combination with prescribed treatments to make those interventions work even better. Self-care refers to the things that you can do on your own to make pain better. In this program, we'll guide you in the use of the very best scientifically supported approaches to pain self-care. You may ask yourself, how can I do anything to influence my pain? It's just there in my back. In order to understand the powerful role you can play in controlling pain, we'd like to share some information about the nature of pain, how pain works within the body, and why what you do matters. There are two types of pain: acute pain and chronic pain. Acute pain can be useful. It helps to ensure our survival and warns us of when our body is in danger. It also keeps us still when we are injured so that healing can occur. After we heal, pain goes away and we can function normally. In contrast, chronic pain is a pain that lasts longer than 3 months. It's also thought of as a disorder since it may not be warning us of any current danger and healing may have already happened. To help untangle the mystery of chronic pain, it's helpful to understand that pain is not produced at the injury site. It always comes from the brain. The brain manufactures pain and makes it seem like it's coming from a specific location in the body. Pain is the brain sending you a message to protect a particular part of your body. Don't believe all that pain is in the brain? There are countless examples of pain being present without a corresponding source of injury. For example, 30% of people who get knee replacement surgery still have knee pain in the titanium knee. The whole diagnostic category of complex regional pain syndrome describes individuals who, after having relatively minor injuries, experience extreme pain. But perhaps the most convincing example comes from amputees who experience pain in their missing limbs. Individuals who have lost a leg will often complain of feeling pain in their missing leg. Clearly, in this case, the injury site cannot be producing pain because it's completely gone. What's not gone, however, is the brain, which remembers the trauma of losing the leg and can still access the sensory areas of the brain that aligned with the leg. Even after the amputation, the brain can continue to manufacture pain and send it to the brain areas that used to correspond with the leg. The person then experiences pain in a leg that is now missing. This pain is real. It's made by the brain, as is all pain. Let's consider an analogy. Think about the difference between a fire and the fire alarm. If the fire and the fire alarm were the same thing, then putting out the fire would always stop the alarm. But in some cases, if the fire alarm is broken, it will stay on after the fire has been extinguished. Pain is like the alarm. It's associated with, but independent of, the actual injury. Fixing an injury does not ensure that the pain alarm will shut off. Sometimes the alarm is disordered, as in some chronic pain states. To understand how we fix pain, we need to dig a little deeper into the nature of pain. Just as the fire alarm uses smoke to trigger its alarm, the brain sounds its pain alarm when it senses a threat. Threat can come from many sources. Often, it is a message from an injury site, but it can also be triggered by a state of unwellness, an emotional event, stressful thoughts, troubling memories, or some threat from the outside world. Pain is the brain's way of giving your attention to a threat, putting you on alert, and keeping you less active. The brain has many responses to threat. While pain is one of them, other examples of responses to threat include staying awake so that sleep is disrupted, emotional changes like feeling anxious or sad, memory and concentration difficulties, and fatigue so you're more likely to stay put. While all of these things combined can make you feel awful, they can also represent the very things you'll want to work on in self-care. Fixing any one of these things is likely to improve the others because they're all related. For example, getting some exercise from walking can return improvements in pain, but can also result in better sleep, feeling less anxious or sad, and better concentration. The monitoring section of Pain Guide offers you the ability to track each of these symptoms. For example, sleep, pain, mood, memory or concentration, and fatigue. For the next week, keep a log of these symptoms daily. Look for relationships between these symptoms. Notice whether some symptoms follow others. For example, does a poor night's sleep lead to more pain the next day? Try and discover the symptoms that you most often experience. In the coming weeks, you'll need to continue to track your symptoms as we begin to offer specific self-care strategies for dealing with pain. If you track your symptoms while engaging in self-care, you'll be able to see which strategies work best for you and for which symptoms.